liver disease is a real issue with a lot of Americans, yet a lot of Americans don't even realize that they have this, and that can be dangerous. But the good news is that Arizona Liver Health is right here in Tucson, and they can help you, and sometimes that is free. Dr. Naeem Alkhouri, who is the director, is joining us this morning. Great to have you here, Doctor.
Good morning. How are you guys?
We're very well, and we're happy to have you here. So I want to just get into it right now in terms of some of the terms specifically. So NAFLD and NASH, how are they different, and what does that mean to the average American?
So non-alcoholic fatty liver disease, or NAFLD, or sometimes we call it NAFLD, means that there is fat accumulating inside the liver cells. So this is what we call fatty liver disease. And this is a complication of obesity and type 2 diabetes and having high cholesterol. A subset of patients with NAFLD or fatty liver, they have the aggressive form of NASH. NASH stands for non-alcoholic steatohepatitis. This is when, in addition to fat, you also have inflammation inside the liver, you have damage to the liver cells, and over time this can lead to scarring of the liver, and in a small percentage you can end up developing liver cirrhosis even without consuming any alcohol. So NASH is the aggressive form of NAFLD or fatty liver disease.
So how do you know you have this? Are there any signs or symptoms that we should be looking for? And can you not have signs and symptoms and still have this?
Yeah, unfortunately, the majority of patients with fatty liver disease are asymptomatic, so they feel fine. Occasionally, they may have fatigue, they feel tired, they may have pain in the right side of the abdomen where the liver is at, but the majority of patients are asymptomatic. And that's why I think it's very important that if you have risk factors for fatty liver disease, such as obesity or type 2 diabetes, that you discuss this with your doctor and at least get your liver enzymes checked. This is a simple blood test that you can do, or get an ultrasound of the liver to see if you have fatty liver or not.
So is that a FibroScan?
No, the FibroScan is a new technology that we actually utilize at Arizona Liver Health, and we offer it for free for the community. It's an ultrasound-based technology, but it's a new machine that can actually quantify the amount of fat you have, and then it can tell you also about how much damage you have to the liver. So it's a very accurate test that can be used as a screening tool for fatty liver disease, but also to determine the severity and the risk of developing liver cirrhosis. Very simple test, non-invasive. It can be completed in 5 to 10 minutes, and the numbers can be followed over time to assess response to treatment as well.
So if that test does come back negative, what are some of the treatment options that people have?
So the first thing that every patient with fatty liver disease should do is try to lose weight. And the goal for us is about 10% of your actual body weight. So for someone who's 250 pounds, we try to lose 25 pounds. If you're 300 pounds, we try to lose 30 pounds. And this can actually help decrease the amount of fat, but also decrease inflammation and scarring in the liver. If you have uncontrolled type 2 diabetes or high cholesterol, these should be also treated, and the management should be optimized. And then we also utilize medications that are not FDA approved, but they may be beneficial, such as vitamin E and a medicine that we use for diabetes called pioglitazone. So these are some of the options, but we also have a rich pipeline of new medications that are in development, and we offer these at Arizona Liver Health as part of clinical trials.
So if we're thinking about entering one of those clinical trials, because I know that they can be so incredibly helpful to potential, treatments and cures in the future, if I'm thinking about doing that, what should I know? And how do I know if that I'm a possible candidate?
Yes. So, before you enter a clinical trial, you need to, first of all, know what phase the clinical trial is in. So we have early phase 1 trials, and then you progress to phase 2 and phase 3. And typically, once you get to phase 2B and 3, we have more safety data, more efficacy data. So the drug has been tested in multiple individuals with the same condition. You need to also know that in clinical trials there is a placebo arm. Typically, we have more patients on the active drug, but there is typically a placebo arm, and that could be 25% of the patients entering the trial, could be as high as 50%. And This is something that we discuss with patients routinely. You will be monitored very closely as part of a clinical trial, and you will come to the clinic more frequently to assess for safety and efficacy. And of course, as part of these clinical trials, all the clinical care testing and the medications will be offered to our patients at no cost to them.
And you would also be helping a lot of people. Doctor, thank you so much for being with us this morning.
Thank you very much for having me, and come visit us at Arizona Liver Health to get a free FibroScan to check on your liver wellness.
Yes, and right now, that's exactly right. All viewers can receive free FibroScan screenings at Arizona Liver Health. If they call this phone number right now, it's 520-485-4000. And for more information, you can check out azliver.com/FibroScan.